Welcome and thank you for joining us for another session of our VU Elevenses program. This session focuses on how you can use our program in your workplace. I'm Alex Parker, a researcher in the Institute for Health and Sport, and I'm also a clinical psychologist, and I lead the VU Elevenses program. And as COVID-19 took hold in early March, we've been offering our program as part of VU's mental health and wellbeing response to the pandemic. And in doing so, we've found meaningful ways to make staff feel supported, connected, and validate the extraordinary challenges brought on by the pandemic. We've seen great results so far. VU Elevenses continues to reach a large number of staff and students, and we're excited to have the opportunity to share this expert knowledge with the community in the West and beyond. We hope our brief sessions on mental health, physical activity, and wellbeing are valuable during such difficult times. And this video provides some guidance on how you might use the program in your workplace. The COVID-19 pandemic affects us all in many different ways, physically, emotionally, economically, and socially. Our program is based on the recommendations from the World Health Organization and evidence from prior pandemics of the importance of routine and consistency during a time of crisis. This is why we run the sessions each weekday at the same time, using an online meeting platform. The name is inspired by Michael Bond's famous Paddington Bear, who enjoyed daily 11 a.m. chats with his friend Mr. Gruber, and we aim to keep our staff and students connected during this time of remote working and studying. Each session is developed in collaboration with university experts in the field of psychology, physical activity, and mental health. The sessions are made up of mini interventions and strategies to help people manage and maintain well-being during this pandemic. We focus on ways to nurture ourselves and our loved ones, how to better manage such a massive disruption, and most importantly, how to avoid being overwhelmed during the COVID-19 pandemic. Our sessions are based on simple, evidence-informed, brief mini interventions and strategies that target 6 essential lifestyle areas for well-being. These include healthy eating, physical activity, reducing alcohol intake, improving sleep, healthy relationships and social connection, and stress management. Now, as Victorians are in stage 4 lockdown and other states are still managing the mental health consequences of COVID-19, our VU Elevenses program videos are free and available for sharing, with more added each week. Very briefly, findings from the first few weeks of the program indicate significant reductions in the symptoms of depression, anxiety and stress reported by our program participants, as measured by a common survey called the DAS-21. We can see that the program has helped protect and improve mental health and wellbeing during this period. At VU, we deliver our program for staff each day at 11 a.m. using an online meeting platform. We send a weekly invitation to the sessions on a Friday afternoon for the following week, so that everyone can block out 11 to 11:15 each weekday. How you choose to use the program in your workplace depends on a range of factors that are specific to how your organisation is structured and managed. You may wish to try out the weekday meetings and share one of our videos in each session. You may wish to email the links to our videos to your staff. You may like to try mixing up some of our content with content prepared by your human resources team or content from reputable organisations that I will mention in a moment. We've already received feedback that workplaces are using our resources in a variety of ways and welcome you to consider how you can make use of this program. As with learning any new skill, we encourage you, your colleagues and your staff to try out and practice these suggestions. You and they are going to get more benefit the more often they're done. If you'd like to personalise the program for your workplace, you may wish to mix our sessions with ones you create based on content available from organisations such as Beyond Blue, the Black Dog Institute, Are You OK?, Relationships Australia, the Better Health Channel, the World Health Organization, and the United Nations, to name but a few. You might talk through a specific wellbeing fact sheet or tips for managing working from home as suggestions you could do in sessions. The emerging data on the mental health impacts from COVID-19, plus information known from prior pandemics, is showing that there's increases in anxiety, depression, stress, irritation, fatigue, avoidance, and withdrawal. It's important that you know the health and wellbeing supports that are offered in your workplace, including access to any employee assistance programs, and how to access external supports if a more formal mental health intervention is required. Australian government websites such as Head to Health and Health Direct have valuable information on accessing online and in-person, although perhaps this will be through telehealth at the moment, mental health programs and services. I'll end with a couple of quotes from participants in our weekday VU 11s program, as they sum it up much better than I can. VU 11s is a great way to stop and reflect and connect. And thanks to you and your team for this great initiative. So wonderful seeing so many participants. It does give a great sense of connection along with the very helpful strategies to use. We hope our brief and simple strategies and ideas may help your workforce maintain their well-being during this time. By focusing on how we can nurture ourselves and others and how to survive this time, rather than aiming to thrive, we hope to get through this period of worry and disruption by supporting each other as best we can. Follow our YouTube channel for further updates and videos, and please get in touch with any questions or feedback. Take care.